That's Harry Styles. It's Dubon 92. We do have a birthday shout out for Reshma. Happy birthday to you, Reshma. That came in from Seneca this morning. Graydon, Nicholas, Zinnia, and our two doggies, Skylar and Alexa. Happy birthday to you. All right, we're talking about something as it is approaching back into what I like to call outdoorsy season, where people are doing outdoorsy things in Dubai, and that might mean you might have to take your shirt off. And I got to be honest with you, I'm not at the level of body confidence where I'd be like, yeah, sure, I'm going to take my shirt off and go to a pool brunch or anything like that. A lot of people feel the same, and therefore they've turned to what I think is being seen as a quick fix solution to these kind of problems. They're taking some sort of a weight loss medication. Previously, that would have been the realm of tablets that would have been vitamin type tablets that you would take. Well, now no more, because you're taking a jab that is supposed to do the job for you. But is it the right thing to do? And are we in fact doing something that is very dangerous and should never be done without first of all speaking to a doctor? Well, we thought we'd get an expert in to speak about this. Dr. Hussam Mohammed Al Trabulsi is a surgeon who specialises in bariatric and laparoscopic surgery. Good morning, Dr. Hussam.
Good morning.
It is somewhat of an epidemic. People taking Ozempic, Wegovy, Manjaro as a quick fix solution for weight loss. Have you seen this increase a lot more with your patients?
Yes, it is indeed. I think since 2 years now, it's becoming more or less like an endemic. So I believe everybody is worried about their how they look. Everybody is more conscious about obesity and what obesity means and what the risk associated with obesity. So yes, losing weight is a good thing to think about, but also you have to think about your health as a whole.
Now, I'm guessing in the long run, we'll see a downturn in people with cardiovascular related issues as a result of them losing weight, which is tremendous. But for people who are taking this without any doctor's advice, without any prescription or anything like that, and they're just going on it, or somebody who might be at 90 kilos or 100 kilos and may not be overweight as such, but may think, you know what, I've got a little bit of fat that I want to burn, I'm going to take this. Is it possible for someone to take this for a short period of time, lose the weight, then come off the medication and go back to your regular life?
Well, there is a couple of tricks in this. First of all, Ozempic is not a medication for obesity treatment per se. It's a diabetic control medication, and weight loss is one of the side effects. So now we can prescribe it as for weight loss, but for obese people. So we need to be a bit conscious about the difference between obesity or moderate obesity or some what we call overweight.
Mm-hmm.
I have some patients coming, they want to lose 5 kilos. Can I use Ozempic or the other brands in the market? So no, this is not healthy, because yes, it is a medication, but like any other medication, Ozempic has many side effects and many results of using Ozempic. So if we can talk about, we have cholecystitis and gallstones. We have a high liver enzyme, which is very difficult to go back to the normal range. We have sometimes peripheral neuropathy. So yes, there is many things, and especially if people have a history of thyroid cancer, in mice or in animals, it's proven that Ozempic can cause thyroid cancer in susceptible individuals. So yes, you should be worried about it. You should take it under supervision. You should do some blood tests before, and definitely you should be following up with a healthcare provider that knows about that subject.
What does it do exactly? So because a lot of people are talking about the side effects when they feel they just don't want to eat anymore, or they're happy to eat the same junk food they were always eating, but they're now wanting less of it. So they're ending up in a calorie deficit. Is that what they're feeling?
Yes. They slow the movement of your gastrointestinal tract, so the food will stay more in your stomach, and they regulate your blood insulin. Once the blood insulin is regulated, you will find less and less urge to eat. So the trick is that if you have a high blood insulin, is what we call it, insulin resistant.
Right.
So insulin is an anabolic hormone. Yes, it regulates the blood sugar, but also it tends to build your fat stores. So most of the things you eat, it will go into your fat tissues and not your muscle to burn it. So once you regulate this, you will have less urge to eat and you need less calories. But most of the people who take Ozempic and stop it, they will regain the weight within a couple of months. And this is again the main problem with that Ozempic. This is why now the trend is heading back down a bit, slowing down. Because the people try it for a couple of months, they lost weight, they stop it, they gain the weight again. They
Right.
took it again, they lost weight, and again they will regain the weight.
So this is very much like when someone takes a diuretic because they want to lose some of the water weight. It's temporary. There is no long-term solution aside from obviously get into the gym, do the exercise, do the hard work. Aside from that, or some radical gastric band surgery, there is no long-term solution here, right?
Yes, correct. You are absolutely correct. And the evidence about this, that people who have diabetes and obesity, they take those injections for life, correct?
Yeah.
They don't lose more weight. They lose weight only in the first couple of 5 to 6 months, and then they will regain the weight again. So this is your body will have a kind of resistance to those injection in a while.
That answered, I think, a lot of the misconceptions that I had about it as well. And I think that's what a lot of people needed to hear this morning. Dr. Hussam, thank you so much for joining us and having a chat about that this morning. Appreciate the insight that we didn't know. Dr. Hassan Mohammed Al Trabulsi, who is a surgeon in bariatric and laparoscopic surgery. Appreciate you taking the time to have a chat.
Thank you. Thank you.
It's not a quick fix solution, guys. That's the key message to take away from here. And even if you go on this, and you come back off it again, you will put the weight back on. You heard the facts on it there. Now knowing that, are you still willing to take it or no?